Hello, ladies and gentlemen. Today I am speaking about one of the most important and serious diseases we can face in plastic surgery and its relations to fasting the holy month of Ramadan or not. Today I am speaking about burns. Of course, there are several types of burns. To start with, I speak about burns which are caused by fires and boiled waters or boiled oils. These burns affect the person in three main problems. The first problem we face is what is known as neurogenic shock. And the second problem is electrolyte imbalance. And the third problem is loss of fluids. Now, these burns which are caused by fire are classified into three types, or 3 degrees. In the first degree, burns affect just the superficial layers of the skin, just epidermis, and cause redness and hotness. And there is no boils, no abscesses. And the person complains just from pain and redness and hotness. In these cases, we find that persons can be given just tranquilizers and painkillers, and due to the development in these drugs, these persons can fast the holy month of Ramadan. In the second degree, burns enters deeper and makes many problems. They can affect the dermis or even the subcutaneous tissue, or even can pass to muscles. In second degree, we can find that these persons are in need to be in close relation, to be in intensive care. They must take fluids in order to compensate massive loss of fluids. They must take painkillers in order to compensate and avoid neurogenic shock. And also we have to perform electrolyte imbalance and return the electrolytes to their normal presence inside the body. In the third degree, we can find burns become deeper and can take off muscles or even can get off of bones. And this case is very serious. And of course, in the second and third degrees of burns, patients are in need to be hospitalized. They are in need to take massive amounts of fluids, such as ringer lactates and or even saline and so on. Also, persons are in need to take painkillers and also might in need to electrolyte imbalance. In second and third degrees of burns, patients are not allowed to fast the holy month of Ramadan. Second type of burn I'll speak about is those burns which are caused by flames, which affect mainly children. These burns can cause laryngeal edema, and the child or the infant cannot take his breath. Also, these flames can enter inside the blood and form what is known as carboxyhemoglobin, which affects the hemoglobin of blood, and this returns to the patient can be in serious condition due to the presence of carboxyhemoglobin and maybe in asphyxia. Of course, these persons which are taking flames are not allowed to fast the holy month of Ramadan. The third type of burns, what is known as chemical burns. These burns, as their name indicates, of course, are caused by chemicals. For example, the first type of chemical, what are burns caused by alkalis, such as caustic soda. In these types of burns, at first, you must take the patient and put it in running water in order to wash this chemical, and then try to neutralize this chemical. As it is alkaline, you have to bring something acidic, such as vinegar. Vinegar present in our houses can be diluted by its size by water, and then can be pushed on the skin which is affected by the alkali, and this can help the patient to be better. Then you have to let the patient to be hospitalized. Second type of burn, what are caused by acids, such as hydrogen peroxide. These types of acids can affect the skin and can cause severe pain, can cause severe loss of fluids and electrolyte balance. Once any person is affected, at first you must to wash this type to be affected by running water, and then try to neutralize this acid by giving an alkali. Simply in our houses we can find bicarbonate sodium, which can be put and dilated 2 big spoons on 1 liter of water, and then you have to push on the affected side in order to neutralize the acid. And then you have to take and transfer your patient to the hospital to be hospitalized. And the third type of chemical burns are those burns which are affected by phenol. And in this type of burns also you must wash the site of affected site by running water, and then try to neutralize by giving alcohol, by rushing it on the affected side, and then try to transfer your patient to the nearest plastic doctor. This is the third category of burns, which are burns caused by chemicals. And the fourth type of burns are the electric burns. Of course, electric burns are caused by electric current. And electric current, once touches the body, it enters the body through one point which is called the inlet point, and may or may not come outside the body through the exit point. If this current, through its passage, this electric current from the inlet point to the exit point passes through the medulla oblongata and affects the person in 2 serious problems. Number 1, if it affects the respiratory center present in medulla oblongata, the patient may complain of respiratory failure. And this person must, of course, take artificial respiration. Otherwise, he will lose his life. The second major problem in this case, that if the electric current during its pathway from the inlet to the exit passes through the centers of the heart, can cause cardiac standstill. And in this case, the person may in need for cardiac massage, whether external or internal, or otherwise the person will lose his life. So once you face an electric burn, at first you must isolate the electric current. Otherwise there is another victim behind the previous victim. Then you have to see your patient and transfer it as quickly as possible. If it's in need for artificial respiration or cardiac massage, external or integral, this depends mainly on the transport of your person. As quickly as you can, you will help this person in order to gain his life. This is the fourth type of burns. The fifth type of burns is that type of burns which are affected by which is caused by pumps or nuclear burns. Of course, this type of burns may be caused simply by radiations to those doctors or those who are working in the field of radiation, or may be caused by pumps in general or nuclear pumps. These types of burns also passes in 3 degrees. In the first degree, it may affect the skin in the form of redness, hotness, edema, or pain. And in the second degree, may become deeper and may affect in the subcutaneous tissue, when passed to the muscles and affect and burn the muscle in very serious way. In the third way, they may come even to the bones and get rid of certain part of the body, of course. In these types of burns, we must take care of 3 main problems. In the first, we have to give painkillers as quickly as we can for fear of the neurogenic shock and the loss of life of the person. The second, we have to give massive amounts of fluids. And these massive amounts of fluids in order to compensate the loss of fluid which is caused by the burn because of the loss of the skin, which leads to shock of the person and of course can lose his life. The third one is we must do electrolyte imbalance. We have to take care of electrons, of electrolytes of the person's sodium, potassium, and so on, in order to see what is less, what is more, and in order to compensate this. Otherwise, the person cannot compensate and survive for life. So, in this type of burns, the patient is not allowed to fast the holy month of Ramadan. Moreover, in the burns caused by pumps, there is radiation which affects the bone marrow mainly in the sternum and other types in the body, which are responsible for formation of blood, all types of blood, whether RBCs or WBCs or even platelets. And accordingly, in these persons, they must take blood transfusion. So in burns caused by blood, we have to keep in mind that they must take blood transfusion, and we have to keep in mind, be closely to these persons in order to see whether there is anemia. And keeping in mind that anemia may be at soon or may be delayed to 1 or 2 months later and so on. So I can summarize that in order to say this person can pass the holy month of Ramadan or not, we can say that this depends mainly on the general condition of the patient. This depends mainly on his life, depends mainly on the degree of burn, depends mainly on the depth and extension of the burn. Persons from the first degree burn, whether they are caused by fires or pumps, can allow to fast the holy month of Ramadan by giving a modern line of treatments which can take for long as more than 12 hours. This is by be given before fasting by injection or in the form of tablets, and these persons can be allowed to fast the holy month of Ramadan. But persons in the second and third degrees for fires and pumps cannot allow to fast because they must take a massive treatment in the form of electrolytes and also in the form of massive fluids and painkillers and so on. As for those who are suffering from burns, from chemical burns, if they were superficial, just by treatment locally and by treatment systemically, they can be allowed to fast the holy month of Ramadan. But those with chemical burns which are deep, more than the subcutaneous tissue coming to muscles and coming to bones, those persons are in need for massive fluids and painkillers and electrolytes to be kept in touch, and of course they are not allowed to fast the holy months of Ramadan. As for the electric burn, we have also to say that for these electric burns, we have to keep in mind that if the electric burn is just superficial and separated, will be in close contact, this person can fast. But if the electric burn is deep, or if the patient lies in cardiac standstill or respiratory failure and so on, these persons are not allowed to fast the holy month of Ramadan and must be hospitalized. Lastly, I can say those with electric burns must be kept in close touch and watch and must be hospitalized at least for 1 week. Why? Because in some cases we find nothing is apparent superficially just after the burn, but 1 week later we find types of aseptic necrosis which affect the affected part of burns. This is my opinion this day, and I can say if the burn is superficial, you can be allowed to fast the holy month of Ramadan, but if the burn is deep, whatever its causes, you are not allowed to fast the holy month of Ramadan. Thank you.